Hi, this is Dr. Stu Currie with MojoFeet, and I'm here to walk you through how to use your new Mojo Matrix Pin Scanner. So this is going to be a how video, what buttons to click and what they mean, how to walk through and get a good scan of your patient's foot. And we're going to save some of the why you would do that clinically and otherwise for other videos. This is more of a how, what buttons to press. So as you can see here, we're going to start right off being on our home screen. There is no Windows password to your MojoFeet laptop that came with your system. You can log in, push enter, and get right to this screen. I want to show you something on this screen on your desktop that you'll be able to access moving forward, and that is a document called the new scanner packet. In here are some documents and information that you're going to have at your disposal so you don't have to memorize everything I'm going to say right now, and you don't have to go back to this video later on. You've got it right here on your desktop. It's some scanning instructions, a step-by-step on how to schedule a training appointment with me, about what the information coming out of the pin system means as far as what the arch drops are doing and what it might mean for your clinical recommendations, as well as a few other tidbits about how to compare the right and the left foot and things like that. The last thing you'll see on here is some of our top covers and some of the pros and cons of each of those. So you've got all this at your fingertips for checking out later. All right, to get started with the Matrix system, you have to have everything plugged in. So we want to do hardware before software. That's a separate video on how to plug everything in. It's fairly self-explanatory. There's a couple cords. One goes to a wall. The most important one is the USB that goes to your laptop. Once that is plugged in, you can start the software. So to do that, you're going to go up and click on the foot scanner icon. At this point, the software starts. It'll take a second or two here to just come up. When it starts, it's going to go look for that hardware that we talked about. So it's going to go looking for your camera. This pop-up will tell us whether it found it, and it did, because you can see something there. If you get an error message instead of that pop-up, the error message can say things like, the camera's not found. It can give a weird message about not being licensed. You are licensed, and that error message basically means there's a problem finding the camera. 99.9% of the time when we get that error or see that error, it's because one of your cords came unplugged. So go back and check your connections, close the software and restart, and 90% of the time that's going to do the trick. You have three tabs across the top of this software. The welcome screen, which is this one, and all we're going to do here is log in. The username for the vast majority of you is Mojo. The password is Feet, F-E-E-T, all lowercase. You click login, it'll tell you you're logged in, and that's all you do on this screen. There's two more screens. The next one over is scan. This is the business end. This is the part I'm going to spend some time walking you through what to do and how to do it. And then we have your third screen, which is your analytics screen, which is what you're going to use to talk to a patient about the results. So let's start with this screen. What I recommend is that when you have a patient in front of you, you're going to put in their information first. And so let's do a test patient. We're going to call him John Test. The reference date here is the current date. The shoe size, you're going to select from a drop-down menu. If the patient wears a half size, you would go up to the next closest size. So if they wear a 9.5, you're going to go to 10. The reason you do that is the only thing the size tells us is how much of this floppy part of the orthotic to give you after we're done with the controlling part, right? The plastic part comes from the shell. It's the controlling part that comes from the cast. right? The floppy part is just a length thing about how much we want to give you off the top. So we ask you to go up a half size because it's always better to get something that's a little long that you can just use some sharp scissors in your office to trim back rather than get something that is too short. So that's what that tells us. There are other ways to indicate size. You can be more exact. So first thing you need to know is that these drop-down sizes correspond with our prefab sizes. So if you have our prefabricated orthotics in your office and you're wondering if a size 10 fits, you can use our prefab in your office in the patient's shoe to see it. Make sure you're always taking that current factory insole out of their shoe to do that. The other way, and the last way, which is a bit more complicated, but if you wanted to indicate exactly how we should cut this template for you, let's say you've got a CrossFit shoe or something with more of a square toe box that you want us to exactly match, you can pull the factory insert out of the patient's shoe, trace it on a piece of paper, and send it over to us via email or fax. It won't currently go through this same software. You can email it to us or fax it to us with the patient name, and we will actually size this top cover there for you. It's not used a lot because it's a few extra steps, and it's usually not necessary. We find that you can get pretty close with the current templates that we use, which correspond to these drop-down menus here. The notes section is our next section along here. In this part, you're going to write anything you want us to know before we make the orthotic. So you can write clinical information. Patient has, a right knee replacement. Patient has plantar fasciitis. You can add things to your order. So you can say, I would like a full foot lift. You can shorten that to FFL. On the right, 6 millimeters for this patient. And you can ask us questions, like, please call me. I have a question before you make this, right? We will read the information and act on it before we make the orthotic. So we're going to read that, and if there's information we need to call you to clarify or make a recommendation, or you've asked us to call you, we're going to go ahead and do that before we make the orthotic, so you can give those indications to us there. The last thing you have to put down here is the operator, and that is the clinician or the person doing the casting. So whoever is casting the patient, we ask you to put your operator initials here, and that is going to just let us know who did the casting should we have a question on it. We know who to call or who to ask for. So that's what goes in there. Once you fill out that information, you can click Save Patient. You don't have to. This software is pretty good at not letting you lose information. So if I tried to close this software or navigate off this screen without clicking Save Patient, then it's going to say, hey, you have unsaved information. Are you sure you want to leave? Yes, no. And you can decide at that point. So it's pretty good at not letting you lose that information. I wanted to save it so I could show you the next few buttons. These buttons at the top are file folders where you can find your patient information. So Reload Patient File is going to be a folder where you can see the patient name, the clinic name here, the date it was casted. You can sort by any of this information just like a regular file folder. The next button down is New Patient. It just wipes the screen. So if you had a new patient in front of you and there's some information up here, you can just wipe the screen by clicking New Patient like I just did, but I am going to go back and bring up John Test here. The last button here in this row is the Load Ordered File button. The Load Ordered File button is all of the orthotics that you have already ordered. So essentially, what we've got here is two different file folders. So in this folder, you're going to see Test. That was a patient order that was already sent. So between the Reload Patient file and the Load Ordered file, you have two places to look for patient files. Here's how they're delineated. The reload patient file is everyone that you have scanned but not sent, right? And the load ordered file is everybody that you have scanned for an orthotic and placed the order. So just two different places to look based on whether or not you have ordered an orthotic or not. So here's the scenarios. The patient comes back after a few months of care. You did do a foot scan on their intake, but maybe you decided not to address the feet at this time. Maybe there were bigger things to look at, right? As far as maybe what their original complaint was. And so you decided to leave the feet while you did a trial of care. You would go find that patient in reload patient file if they now decide that, or you decide that you want to look at that again with your patient. So you'd go ahead and load them up and you would find them in that folder. If on the other hand, a patient comes back and says, hey doc, I've been wearing these orthotics for a year now, but they're great, they're totally taking care of my problem, but I would like to order a second pair. Well, since you've already ordered a pair, you would go find them in load ordered file. And that's where they'd be located. You can bring them up, you can change some specs if you want, you can update a body weight, you can do different things like that, and you can resend the order over to us. Speaking of second orders, this is the only other thing I'm going to comment on this page, which is the revision number. When you have a patient that you are rescanning for whatever reason, let's say it's been a couple years and you want to decide if their foot has changed at all. You may be rescanning patients to compare to their original scan. If you're doing that, go ahead and put a revision number in this revision box, and that will put a number in the file name. So now you can see John Test 2 and John Test 1. If you add a revision number, that make sure you're not going to overwrite their original file and you now have the whole history of the patient from start to finish. So you can change that revision number however you would like to do that. Okay, now that we have all of the patient information entered, the next thing we're going to do is start the scanning process. The scanning is done by clicking on these 4 buttons in this area here. When you have a patient in front of you, you're going to start with the corrected right foot. So you're going to set your patient up to capture the ideal foot posture. This is where we induce the correction for the right foot. That's a separate video on how actually to do the casting part of that. But for now, we're going to focus on what buttons you click once you have the corrected cast. So the first one's going to be right foot. Once you have the cast taken, you're going to put the pins up on the scanner box with the heel and toe stickers matching the heel and toe stickers on the box, and you are going to click right foot. Image of the patient's right foot will come up. Note that you can left click, hold and drag this to show the patient that this is indeed a 3D cast of the patient's foot in their corrected arch posture. You can see there's a nice arch in this foot here, right? How to evaluate your cast, the things I like about this scan is that the tripod is down. So the heel, the 5th metatarsal up here, and the 1st metatarsal head are all in the same plane. Good cast, good correction. If you ever get spun around like I did there, where you get flipped upside down or turned around, these angle views over here will take you back to something that looks like you want it to look. And that is the corrected right foot. The next thing we're going to do is do the corrected right stance. Okay, so once we have captured the standing right foot, again, those instructions are a separate video. You're going to place it back on top of the box. One thing to note is that you do not reset the pins when you're staying on the same foot. So casting between the corrected version of the foot and the full stance version of the foot, you leave the pins as they are and have the patient place their foot lightly back into the pins in that same mold to then go ahead and stand on it. You don't need to reset the pins. This helps the software compare the two images more exactly. But once you have had them create their stance phase cast, you go ahead and put it back on the scanner box, and you're going to click Right Stance. And you can see that the patient has much more of a collapsed arch in this version. As you can also see up here, your views start to populate. So now you can actually note to the patient, here's your foot where it should be, and here's where it collapses to. And it's the difference between those two casts and how much you collapse that helps me make some decisions about what we're going to do with your foot. So you can start to see these views populating up here. One thing to note in here is that these buttons can be repressed. So let's say you didn't quite get the pins on the scanner right, or there's something about the cast you don't like. Maybe you didn't quite get the first metatarsal all the way down, and you want to go ahead and repress that down with the patient's foot. You can put their foot back in the pins, re-push down the first metatarsal, and then you can actually click the same button again, and it'll rescan it. So let's say I wanted to take the right stance again. I could click Right Stance. It'll ask me, do I want to overwrite this? I'll say sure, overwrite it, and it'll rescan it. Now this is going to look exactly the same because I'm just rescanning the one I just did, but I wanted you to know that you can overwrite things here. A couple other thoughts while I have them, a little bit of housekeeping. Cleaning. You can clean your pins with any kind of a clear spray, Lysol wipe, anything that is non-sticky. The pins are friction-based. So if you submerge them, don't do that. And also don't use any sticky cleaners, things that would build up with a residue. Try and stay away from that. But otherwise, you can wipe these down with Lysol. You can spray them. You can clean them off in between patients if you would like. I usually recommend leaving socks on. There's no real need to take socks off. It doesn't affect your casts unless it's some thick hiking sock or has a pad in it or something to that effect. So otherwise, you're good to leave socks on. As far as how big of a foot you can cast here, this pin deck will fit up to about a size 14 or 15. So it depends on the heel to ball ratio, but you try to leave a few pins behind the heel, right? But if you can't, that's okay. In fact, if you get over a size 15 in that rare instance, I would rather you back the heel off the scanner because we can recreate the curve of the heel, and I would rather have the met head location, if that makes sense. So you'll be able to fit a ton of sizes, and the vast majority of people on here, we recommend you do hang the toes off. We don't need the toes because, again, the controlling part of the orthotic ends at just proximal to the metatarsal heads, right? Okay, back to our scanning, where we're going to continue now scanning the left foot. Once you have scanned the left foot in the corrected position, again, instructions are in a separate video for that, you're going to go ahead and want to click the left foot button. Now, side note here, you do need to reset the pins by grabbing the handles and pushing them down on a table or a flat surface to push all the pins back up when you go between the right and the left foot. Obviously, you can't, impress over the left foot over the right foot. You do need to reset the pins in between the left and the right foot. So once you have that done, you're going to click left foot. And here you can see, again, the things I'm looking for: fifth metatarsal, first metatarsal, and heel, all in the same plane. I can get a better view of that by going down here and seeing that everything looks good. They're all the same color too, right? It's color coded. So the white, reddish white here is all in the same plane, which is the floor or the pin, the plastic part of the pin deck, right? So you got it all down to the same level, leaving this nice corrective arch, which you induced with your thumb. Once you have captured the left corrected or the left ideal foot posture, you move on to the left stance. Again, remembering that when you move in the same foot from left corrected to left stance, you do not reset the pins. You have the patient put their foot lightly back in the mold, do your stance procedure, and then grab the pins and go ahead and put them on the box, getting ready to click left stance. Once you click left stance, you will get the full stance version of the patient's foot. Now we have all 4 views populated. Right foot corrected, you can see a nice arch. Right foot stance, left foot corrected, left foot stance. Right, so we can see the foot collapsing between the two. Again, I am reminding the patient that this is normal. Some amount of pronation is normal, and what this is allowing me to see is how much pronation there is and what, if anything, we need to do about it. Okay, so now that we have all 4 scans of the patient's feet, that usually takes 3 or 4 minutes or so to get that done. Congratulations, you have all the scans you need to make a good analysis. That's going to be the topic of a next video, which is how to analyze and talk to patients, how to use the software to explain things to a patient as you are deciding whether they need a custom orthotic.